obviously we're talking about mouth cancer awareness. Can you just tell us, obviously many people will know about and I'm saying this really flippantly, but the more common cancers, the lung cancers, breast cancer, but mouth cancer probably doesn't get as much press, and people might not know what mouth cancer is. Can you just give us a bit of a rundown as to what it affects and how it can affect people?
Well, we're talking here about cancer of the soft tissues of the mouth. So we're talking about lip, cheeks, tongue, floor of the mouth, and then back of the mouth into the throat, because it's all the same tissue going down there. So in technical terms, they're the oropharyngeal cancers, but it's really anything around the soft tissues of your mouth there. And you're quite right in saying that people's awareness of them is remarkably low, even despite high-profile diagnosis in recent months of Michael Douglas with late-stage mouth cancer. We still found from our survey that over 10% of people didn't even recognise that mouth cancer existed, whereas in fact it's a real killer. It kills more people than cervical and testicular cancer combined.
What are the key things that sort of contribute to it? I'm presuming smoking's got to be a factor, hasn't it?
Absolutely. There are well-established risk factors, the use of tobacco in any form, smoking or chewing tobacco, particularly if that's combined with excessive use of alcohol, can actually raise the risk of getting mouth cancer by up to 30 times. We also know that poor diet can play a part as well. And more recently, we're beginning to see an increase in mouth cancer cases in young people, and this is thought to be related to the HPV virus, the human papillomavirus, that is the cause of cervical cancer in women.
So there are many things that we need to be looking out for. What about just general oral health? I'm presuming it's very key for us to have sort of good brushing practices and keeping our sort of mouths healthy in general, even if, for non-smokers and non-users of tobacco, so to speak.
Yeah, we all have an individual responsibility for the health of our mouths. The important message that we want to put across is actually to be self-aware. Brushing is important, looking after our mouths, but also just being aware of what is happening inside our mouth. For example, if you have an ulcer that doesn't heal after 3 weeks, that's a persistent ulcer, that could be a sign that something's not right. Or we would encourage people to have a look round the inside of their mouth, and if they see a red or white patch or an unusual lump or bump, then very much the call to action is, if in doubt, get checked out. Go along to your dentist, get it checked by an expert.
And just tell us a bit more about mouth cancer awareness. Is it Awareness Week or Awareness Month?
We're on to action. We've moved from awareness because we think we have moved awareness over the last 10 years forward a little bit. So we're moving on to action now, what we're really doing. So we've got Mouth Cancer Action Month. And what we're doing there is really, as Henry has said, encouraging people to be self-aware of what's going on in their own mouth and to take action and get themselves checked out if they've got any doubts at all about anything that's going on in their mouth. Your dentist would always rather see you and say, no, there's not a problem, because the big thing here is it's late presentation. So it's these things presenting as stage 3 and stage 4 cancers in the late stages that lead to these tragic figures of almost half of patients diagnosing with mouth cancer dying. If we catch them early, 90% of them survive, and the treatment is so much more simple. So dentists would always rather look at something and say, no, not a problem, don't worry about it, than have somebody who sort of lingers, doesn't get along there, and get it checked out at an early stage.
And just finally, for Londoners listening to this, what would your sort of maybe 3 or 5 key things that they should be doing when it comes to the sort of oral health and looking after the inside of their mouth and their teeth, what would you say to them?
Well, I think there's the three key messages in terms of general oral health is cut down on the frequency of sugary foods and drinks, visit the dentist regularly as often as they recommend. We've gone away from the sort of routine 6-monthly checkup, so consult with your dentist, see how often they want you to go, and brush twice a day with a fluoride toothpaste. Those are the key oral health messages. As regards mouth cancer, be aware, as Henry said, any unusual red or white patches, any lumps in the mouth or neck area, any ulcer that doesn't heal over a period of 3 weeks. If in doubt, get checked out.
Absolutely brilliant. Just finally, is there a website we can go to for more information?
You can go to mouthcancer.org, or we also have a helpline on 0845 063 1188.
Absolutely brilliant. Thank you for that, guys.
Thank you.
Pleasure.